Today, we are going to talk about a controversial topic: coffee. Yes, everybody's favorite. Some people say that drinking coffee causes blood sugar spikes and is bad for insulin sensitivity, whereas others say that coffee is actually good for blood sugar control. To get to the bottom of this, I did some research on how coffee influences your blood sugar and insulin sensitivity, both for people with diabetes and without diabetes. Caffeine, the main ingredient in coffee, can have a surprising impact on your blood sugar levels. This might be due to some few reasons. 1. Stress hormones. Caffeine triggers the release of stress hormones like adrenaline and cortisol. Adrenaline signals your liver and muscles to release glycogen. This will cause a temporary spike in your blood sugar. An elevated cortisol can eventually lead to insulin resistance, and this will make it hard for your body to manage blood sugar levels. 2. Insulin sensitivity. Caffeine can make your cells less responsive to insulin. Caffeine's relationship with insulin sensitivity is both fascinating and a bit complicated. It can have a short-term downside, but they also offer some surprising long-term benefits. In the short term, after drinking caffeine, your body's cells can become less sensitive to insulin. Studies suggest this drop in insulin sensitivity can be as much as 15%. Now, why does this happen? It's because caffeine boosts stress hormones like adrenaline, which interferes with how your blood cells absorb glucose. For people with type 2 diabetes, caffeine can make it hard to control blood sugar. Research shows that caffeine can raise blood sugar by about 8% compared to days without caffeine. If you already struggle with insulin resistance, this could be a concern. Now, interestingly, in the long term, people who drank coffee regularly might see benefits. Some studies linked habitual coffee drinking with improved insulin sensitivity and a lower risk of developing type 2 diabetes. Eventually, your body might adapt to caffeine, and this will lessen its immediate impact on insulin. Regular coffee drinking go beyond caffeine because coffee is packed with antioxidants and polyphenols that can help your body handle glucose better and support insulin function. So, coffee and insulin sensitivity have a bit of love-hate relationship. A long-term studies don't provide a clear-cut answer. Research large-scale reviews of clinical trials found mixed results. Some studies showed that coffee drinkers had lower insulin resistance, but it wasn't consistent after deeper analysis. In healthy younger individuals, long-term coffee consumption doesn't seem to have a significant effect on insulin sensitivity. Cohort studies, which tracked people over time, often showed a clear pattern. Regular coffee drinkers tend to have a lower risk of developing type 2 diabetes. These findings suggest that coffee might improve insulin sensitivity over the long haul, possibly because of its other compounds like antioxidants and polyphenols. So, in the short term, caffeine can reduce insulin sensitivity and raise blood sugar. However, the body may adapt over time. For instance, one study found that after 4 weeks of drinking lots of coffee, people's fasting insulin levels actually increased, which suggests decreased insulin sensitivity during that period. There is still a lot we don't know. Most studies focus on specific groups like young, healthy individuals, leaving questions about how coffee affect people with different health conditions or lifestyles. The mixed results from clinical trials versus observational studies highlight the complexity of caffeine's role in glucose metabolism. So, long-term coffee consumption might reduce the risk of type 2 diabetes according to observational studies, but clinical trials don't consistently show significant effect on insulin sensitivity. So, the reality is coffee's impact is likely influenced by individuals' factors like genetics, health status, and overall diet. If you enjoy your coffee, keep sipping. Just be mindful of how it fits into your overall health. And as always, it's a good idea to listen to your body and consult with your doctor if you are managing blood sugar issues. Now, the third reason could be adenosine blockage. Caffeine blocks adenosine receptors, which plays a key role in insulin production and glucose uptake. This can make it harder for your muscles to absorb glucose efficiently, even if there is enough insulin around. And the fourth reason may be sleep disruption. Too much caffeine can mess with your sleep. Poor sleep in turn reduces insulin sensitivity, making it harder to even control your blood sugar. So caffeine relationship with blood sugar is a bit of I would say a mixed bag. It has some potential benefits for glucose metabolism, especially over the long run, but it's not without its challenges. And not everyone reacts to caffeine the same way. Some individuals might see minimal changes in blood sugar, whilst others may experience more pronounced spikes. The type of coffee you drink can also influence your blood sugar levels, depending on factors like how it's prepared, what's added to it, and its bioactive components. Black coffee, for instance, is without added sugars or cream, and it's often linked to improved blood sugar control. Its rich polyphenols like chlorogenic acids may help enhance glucose metabolism and reduce inflammation. People who stick to black coffee often report better insulin sensitivity compared to those who add sweetness or cream. But a caffeine in black coffee can temporarily increase blood sugar levels by reducing insulin sensitivity shortly after consumption. Now, when you add sugar or cream to it, it can significantly increase the calorie and carbohydrate content of your coffee, which can cause blood sugar spikes. For individuals with diabetes, these additives can make glycemic management more challenging. Even milk contains carbohydrates that affect blood sugar, though its fat and protein content may moderate the spike compared to sugary additive. Decaffeinated coffee also retain many of the antioxidants and polyphenols found in regular coffee, which contribute to its potential health benefits. Research suggests decaf may lower the risk of type 2 diabetes, likely due to these compounds rather than caffeine itself. Decaf is less likely to cause blood sugar spikes, sometimes seen with caffeinated coffee, and this makes it a good option for those sensitive to caffeine. Now, some like their coffee cold brew. Others prefer hot brew. Cold brew is less acidic than hot coffee, which can be gentler on the stomach. Studies comparing these effects on blood sugar are limited. The brewing method might affect the extraction of beneficial compounds like antioxidants, which play a role in glucose metabolism. So the type of coffee you choose matters. black coffee and decaf options are generally better for managing blood sugar, especially for those with diabetes. Sweetness and cream, however, can quickly turn coffee into a blood sugar challenge. Pay attention to how your body responds and adjust your choices to fit your health goals. Now, caffeine intake can be a bit tricky for people managing diabetes. It's generally safe to take it in moderation. Its effect on blood sugar can vary from person to person. The Food and Drugs Authority recommends up to 400 milligrams of caffeine per day for healthy adults. That's about 4 to 5 cups of coffee. For people with diabetes, even smaller amounts like 200 milligrams or 1 to 2 cups of coffee might affect blood sugar levels significantly. Like I said, it doesn't affect everyone the same way. Some individuals may notice pronounced sugar spikes after drinking coffee, whilst others may not experience any noticeable change. Factors like genetics, current blood sugar control, and overall tolerance play a role in how caffeine impacts glucose levels. So, check your blood sugar levels before and after consuming caffeine to understand how your body responds. This can help you determine whether you need to adjust your intake. If you are unsure of how caffeine affects you, begin with small amounts like half a cup of coffee and gradually increase it if your body tolerated it well. Talk to your doctor or healthcare provider about your caffeine habits. They can help you understand how caffeine fits into your overall diabetes management plan. If you notice significant blood sugar fluctuations, your provider might recommend alternatives like decaffeinated coffee or herbal tea. Another important point is the time you take your coffee. When you drink your coffee can affect your blood sugar levels, especially if you are managing diabetes or keeping an eye on your glucose levels. Drinking coffee before or during meals can cause your blood sugar to rise. For people with type 2 diabetes, studies show caffeine can lead to about 8% increase in blood sugar levels compared to days without caffeine, because caffeine temporarily lowers insulin sensitivity, making it harder for your body to absorb the glucose after eating. Caffeine can reduce insulin sensitivity by up to 15% shortly after consumption. This effect is stronger when coffee is consumed close to meal time, as it interferes with how your body handles insulin and glucose right after you eat. So, if you are concerned about post-meal blood sugar spike, try drinking coffee between meals rather than with them. This might help reduce caffeine impact on blood sugar after eating. If you are managing diabetes or are concerned about blood sugar, the timing of your coffee matters. Try separating your coffee from meal times to minimize its impact on post-meal glucose levels. And remember, regular habits might reduce caffeine's short-term effects over time. As always, if you are unsure of how coffee fits into your diet, it's a good idea to chat with your healthcare professionals for personalized advice. And if you are managing your blood sugar, especially with diabetes, having coffee on an empty stomach might not be the best idea. Drinking coffee without food can cause a temporary blood sugar rise. Caffeine stimulates your adrenal glands to release adrenaline, which tells your liver to pump extra glucose into your bloodstream. For those with diabetes, this can make blood sugar harder to control. Without food, your body has no buffer against adrenaline-driven glucose release, which can lead to a sharper spike in blood sugar. How coffee affects you depend on several factors like your caffeine tolerance, diet, and overall health. Some people may notice significant blood sugar spike from coffee on an empty stomach. Others may not see much change at all. Now, here are a few tips to enjoy your coffee without spiking your blood sugar. If you have diabetes or are managing your blood sugar, try decaffeinated coffee. Decaffeinated coffee is a great option if you are sensitive to caffeine's effect on blood sugar. It retains the antioxidants and other beneficial compounds of regular coffee, but without the stimulating impact on insulin sensitivity that can cause blood sugar spikes. You can skip the sugar and cream. Drinking black coffee is the best choice for managing blood sugar. Sugars and creamers can add unnecessary calories and carbs, which lead to higher glucose levels. If you like your coffee sweet, go for a non-caloric sweetener like stevia or monk fruit, which don't raise blood sugar. You can also choose low glycemic milk alternative. When you want to add milk, pick options like almond milk, coconut milk, or flax milk. They are lower in carbs compared to regular dairy milk. Lactose in cow's milk can elevate blood sugar levels, so these alternatives are gentler on glucose levels. And then time your coffee smartly. Wait 3 to 4 hours after waking up before having coffee. This allows your body to wake up naturally, potentially reducing caffeine's effect on insulin sensitivity. And then drinking coffee away from meals can help avoid compounding blood sugar spikes that might happen during digestion. You can also monitor your response. Everyone reacts to coffee differently, so it's worth tracking how your body responds. Test your blood sugar before and after coffee to understand its effect and fine-tune your habits. Also, pair your coffee with water or drink water before your coffee. Staying hydrated supports your metabolism and may dilute coffee's impact on blood sugar. You can also limit your portion size. Drinking too much coffee can increase insulin resistance over time. Stick to moderate portions. At least 1 to 2 cups per day is a safe starting point. And then you can also consider green tea. If you are looking for a caffeine alternative, green tea is an excellent choice. It's lower in caffeine and studies shows it has positive effects on blood sugar without the risk that comes with coffee. These small changes can make a big difference in how coffee fits into your overall sugar management plan. For tailored advice, consult your healthcare provider or your doctor. They can guide you based on your individual health needs. And this information is for educational purposes only. Before you make any significant changes to your diet, consult with your doctor or your dietitian. I believe you found some value in this video. Please like, share, and subscribe. There's also a bell button that you can click that will help you turn on notification so you know whenever I post a new video. Thanks so much for watching. I will see you in my next video.